So in this video we are going to talk about myofascial release or connective tissue release. So in your theory video I said about direction. So with all massage you should work with the flow of the blood, so generally up. Myofascial release is slightly different because you're trying to move the fascia in the direction it needs to go, so you can't necessarily randomly work upwards, you have to work out which direction you need to go. So first of all you have to test your fascia and decide which way you want to move it. And very simply here we just palpate. So what we do is very lightly we put our hands on and just see which way the fascia moves best. So it's moving quite well here, but you just want to go up and down. You can press a little firmer if you're not getting the results you want, but normally you'd find stubbornness going in that direction, because what happens is we curl up forward when we do stuff, so all the fascia gets drawn this way, so quite often you need to move it back this way. Not always, and you should always test, but generally that's how it works. So you just feel which way has the best movement. You could be looking at diagonals. So it moves in very well, a little less that way, a little less that way compared to this way. So I might start by trying to want to move the fascia in this direction and this direction. So there's several ways of doing it. You start first of all very superficially, and you can use a very loose, relaxed forearm. And all you do is push gently and allow the fascia to lead you. So you don't try and force it in a direction, you go with it. So you can't use massage lotion with this, you need to use a wax with this. You can sometimes do it without, but it does make it a little bit harder. And what will happen as you go down, sometimes you'll find you'll get stuck and you just sit and you wait until it allows, or the fascia releases and allows you to move on, and then you'll be able to move on. And that could take time. So this form of treatment is very much about patience. So that's one way of doing it with the forearm. The other way is flat hands. So quite often I will hook under here and pull the fascia round and then just follow it down. And again, as I said, this is a very slow treatment, so you have to work with the fascia. And you need to keep your hands relaxed, your hands aren't tight. Most of the pressure and force is at the palm of my hands rather than my fingers. And then if you want to get into the fascia slightly deeper, you can do your pinch and push. So you hold it, crescent it, and then push the direction you want it to go, and just hold it there and allow it to relax and release. So as I say, you can go any direction, so you might want to do a double flat hand this way. And then what you will do regularly throughout your treatment is just palpate and test the difference in the fascia and its movement to see how you're getting on with it. So another technique is with knuckles. And as you can see, my hands are very loose. I don't grip tightly. I've tucked my thumbs one inside the other to keep them out of the way, but the rest of my hand is quite open. And that's quite important when you're doing myofascial release, because you can spend a long time in one position. So if you do, you want to be as relaxed as possible. So that's a few techniques of myofascial release on the back.